The pleasure is mine this evening to introduce our guest speaker, Dr. Andre Williams. Extensively trained as a conventional oncologist, Dr. Williams has received international award for his work in a developing country. He then did further international training in nutrition and wellness strategies. He believes the body was built to heal itself and employs his wealth of experience to guide you towards complete wellness. Dr. Andre is also a certified Gerson practitioner with the Gerson Institute, San Diego, California. The Gerson therapy is a decades-old approach to treating cancer and other chronic illnesses using aggressive nutrition. He is also certified in basic and advanced prolozone therapy techniques by the American Academy of Ozonotherapy. His qualifications and awards include twice shortlisted for Jamaica Rhodes Scholarship, Doctor of Medicine and Hematology, University of West Indies, Mona, 2016 recipient, International Development and Education Award, American Society of Clinical Oncology, member of American Society of Clinical Oncology, European Society of Medical Oncology, and American Academy of Ozonotherapy. Ladies and gentlemen, please make welcome Dr. Andre Williams.
Thank you, Madam Chairwoman. Madam Chairwoman Stacey Ann Williams, past president of the Kiwanis Club of Providence, Montego Bay. Taj Cobham, president of the Kiwanis Club of Providence, Montego Bay. Mrs. Kadeen Miles Campbell, Lieutenant Governor, Kiwanis Cornwall Division 25. Ms. Hope Marks, Kiwanis International Trustee. Mr. Leroy Williams, Mayor, Montego Bay. Reverend Conrad Pitkin, Custos Rotularium for the Parish of St. James. Ms. Janet Silvera, President of the Montego Bay Chamber of Commerce and Industry. Pastor Joy Keane of Family Church on the Rock, Montego Bay. Mrs. Colleen Lawson Taylor, immediate past Lieutenant Governor, Kiwanis Cornwall Division 25. Ms. Kay Francis, immediate past President, Kiwanis Club of Providence, Montego Bay. Mr. Michael Leslie, Acting Director of the Jamaica Cancer Society. Mr. Alan Beckford, the Director of Becca Sports. Ms. Shanice Lewis, representing Awards Power Tools. Kiwanians and guests, good evening. I certainly would like to loudly as we can via Zoom, congratulate the Kiwanis Club of Providence, Montego Bay for their stellar service in the interest of raising breast cancer awareness. I had a look at the flyer that is being used to promote the event, and I noticed three very interesting taglines. One of which is support the fighters. The next is admire the survivors. And finally, honoring the taken, or to honor the taken. And I want to say just how appropriate these three statements are. They're so necessary. If I may, though, I would like to challenge us all. I mean, the Kiwanis Club of Providence, Montego Bay has already done such an amazing job over the past several years with this annual run or walk run. And I'm sure that the ladies there are not intending to stop there. So I want to challenge us this evening, in addition to what has already been suggested. The motto that I want us to look at tonight is expand the story. Expand the story. And the reason why I think it's so necessary to expand the story is that we speak loudly about the beginning of the journey with breast cancer. We speak about screening, we speak about self-examination, and we speak about all the various ways that you can detect breast cancer early. But is this really the beginning of the journey? We speak proudly about the end of the journey, whether that be survivorship, or in some cases, we have to speak sorrowfully and tenderly about those who have passed away. But is this truly the end of the journey? I'd like to suggest tonight that it would be useful for us Not just the ladies who have worked so hard to put this whole event together, but for us as a society and certainly as a nation to start considering an expanded discussion surrounding breast cancer. So let's talk a little bit about the beginning of the breast cancer journey. In most of our efforts, we speak about the beginning being when a woman finds out that she has been diagnosed with breast cancer. But many of the previous speakers have alluded to the fact that this really isn't the beginning. The entry point to the breast cancer journey, in my experience, certainly as a doctor, usually begins when a woman hears that her family member or friend has been diagnosed with breast cancer. And the usual response to getting that information is a sense of helplessness. It's a sense of not knowing why this happened to your friend or loved one and not knowing necessarily how to prevent this from happening to you. So I want to suggest, certainly for the cohort of women who are being diagnosed with breast cancer at age 40 and below, or certainly for women who have a family member or friend who has been diagnosed and the person who is hearing the news is below age 40, this kind of creates a dilemma in the mind of that woman. Let's assume that this young lady is 25 years old. It now means that possibly between ages 25 all the way to 40, there is a sense of inner turmoil in which this young lady now has to wonder, I'm not sure what happened to Auntie, whatever the case may be, Auntie Jane, or to my friend. Sometimes somebody my similar age has been diagnosed and nobody seems to know why. I'm not quite sure what I need to do other than early screening to get myself safe. So I wanted to introduce the concept that might be useful, especially since we have so many women on the call, the concept of the role of iodine deficiency, for example, in breast disease. So it has been well documented that a lack of iodine in the diet, for example, is certainly associated with a higher risk of fibrocystic breast disease. And one can imagine a young lady who has a family history of breast cancer who then develops a lump. That's a very unpleasant place to be in. And as doctors, we try to reassure this young lady, hey, don't worry about it. It's just a cyst or it's a fibroadenoma. You're not at any risk of breast cancer. But is that really reassuring for the woman? And so I have had the privilege of being able to suggest to some of these women who come by the office, listen, there is a role for increasing your iodine intake. We live on an island. Most of our agriculture comes from soil that is repeatedly farmed. Most of us don't take in much seaweed. I don't want to do a poll at the moment to find out how many of us have eaten seaweed in the last year. But certainly, the most prevalent sources of iodine in our diet are hardly consumed by us as Jamaican women. And I could give a whole dissertation on how at risk Jamaican women are, and men, for iodine deficiency. And I could also present so many cases of women who have come to the office who have had iodine replacement done and have benefited tremendously in terms of their cysts disappearing. The literature also seems to suggest that there is a role for preventing breast cancer as well. And so this is a part of the conversation that needs to be brought to the fore as we expand the story. The other thing about the beginning of the breast cancer journey is that oftentimes a woman who is way below the age of 40 is not so keen on hearing a message about mammography simply because she doesn't feel as if it is accessible to her. And certainly women who are already at the eligible age oftentimes are reluctant for various reasons. And I'd like to propose to you, as I'm sure we're well aware, that the main reason that women are in need of this kind of breast health awareness month or breast cancer awareness month is that women generally have a sense of helplessness as it relates to breast cancer. And as a result, there's a reluctance to even find out. if there is a possibility that you may be at risk for breast cancer. Most women are not keen on finding out, and the very brave ones who do certainly need to be applauded. And again, I'd like to put a plug in for what the Kiwanis Club of Providence Montego Bay has been doing, certainly for our city, to raise awareness. I need to also make a plug for the role of infrared breast imaging, which is a technology which is not intended to screen for breast cancer, but it can be used by women of any age, certainly even women who are pregnant. And it helps to create a timeline or a way of tracking your breast health over time. It's totally painless, totally radiation free, very quick and easy, and it is well documented to be useful in tracking the health of your breasts every 6 months to a year without necessarily having a discussion around breast cancer. It actually is documented to be one of the most reliable ways to assess your risk of breast cancer, such that if a woman has a thermogram that shows abnormal features, it increases her breast cancer risk long-term significantly. And so it would be a good time to find out long before you either are eligible for a mammogram or long before you even need to have one done for whatever reason. It would be good to start proactively checking our breast health. And of course, as I'm sure many people are aware, this technology is available here in Jamaica at Teshuva Wellness. So I want to encourage that, not just because of my association with that company, but because I'm passionate about seeing women not be paralyzed and feel like they need to be reactive to this concept of the breast cancer journey, but rather to be proactive. The second thing to consider is what happens in the middle of the breast cancer journey for a woman. I would love to see us focusing efforts, and by us, I include myself, I include various corporate stakeholders. I'd love to see us focusing more on highlighting the journey of patients who are actually undergoing treatment. And the reason is that there's a somewhat of a mystery, there's a mystique around what breast cancer treatment involves. And I think if we were able to highlight a little bit more people who are actually undergoing it, we might be able to remove the veil, remove some of the mystery surrounding what the treatment involves. And I suspect that people will be a little bit more open to perhaps going to have their breasts examined, doing their regular screening, if they understood a little bit more about what treatment actually entails. And along that same line, for the middle of the journey, I think it would be good to see more support groups for those women who are going through treatment, and even more importantly, for the relatives of the women who are undergoing treatment. I'm so sad to see in many cases women who are diagnosed with breast cancer and their family member is so supportive of them throughout the journey. And of course, in many cases, the women actually survive the journey. They heal from breast cancer, but the caregiver is so burnt out at the end of the journey that it becomes almost overwhelming, and they themselves often need attention at the end of the day. So I want to just put these in the pipeline, certainly. These are things that I would love to also partner with the various stakeholders on to see if we can strengthen the existing support groups and create and promote even more extensive ones within the city of Montego Bay and beyond. And then we talk about the end of the breast cancer journey. And I think it's always a good marketing and promotional tool to highlight the survivors. And certainly the Kiwanis Club of Providence, Montego Bay, has done an excellent job of highlighting survivors over the years. But here's a question about survivors, though. A survivor is a very good person to present to the public, certainly to say, hey, listen, this person was diagnosed with breast cancer and they survived. But do we actually ask ourselves, how are these survivors reintegrated into society? My experience as a physician is that most of my clients who have healed from breast cancer are not quite sure how to resume life. Relatives often are very protective of them, don't want them to step on a stone, don't want them to go out into the sun, don't want them to do much work. Certainly, and that's quite understandable because the relatives often go through this journey of being afraid that they will lose their loved one. But many of these patients would love to be able to participate in household activities again, in societal and social activities again as well. And they really don't like the feeling of being handled with kid gloves, as it were. Similarly, the survivors are constantly in a state, many of them, of wondering, okay, so I've completed this journey, what now? How do I reassess myself? How do I assure myself that I've in fact completed the journey? Will this thing happen again? What caused it to happen in the first place? And the more we can promote discussions around these topics, not just from the point of view of saying that this individual has survived breast cancer and so can you, but to broaden the conversation, to expand the story somewhat, to look at reintegrating these women into society in a meaningful way. And again, I know the Kiwanis Club of Providence, Montego Bay, has been very active in doing that as well. Ms. Janice Silvera highlighted earlier the financial toll that it took on her relative as well as on the family at large, going through that journey with her mom, I believe it was, who was diagnosed, unfortunately, with breast cancer. And this is another point at which the cycle, it becomes almost a cycle of from beginning to end, because now having gone through the journey, we're now back at the beginning where the female family members oftentimes are saying, wow, this is really rough. I would not want to have to go through this again, either with my relative, or I would certainly not want it to happen to me. And so we're back at the beginning of the journey for somebody who hasn't even been diagnosed, but who has a family member or a friend who has been. And now they experience that emotional turmoil, trying to understand what caused this to happen to my family member. What can I do to reduce the risk of this happening to me? And certainly, what can I do to help my family member whilst I help myself? And so the challenge becomes tonight, how do we expand this story? I believe that Jamaica is perfectly poised and is the best position to have an expanded look at the concept of breast cancer. And the reason is, as I travel the world to various workshops, trying to expand my own knowledge and experience and expertise in treating breast and other cancers, I've come across so many tools that fascinate me. I've come across women who, without using chemotherapy or radiation, for example, have managed to live 25 years past their diagnosis, 30 years, 40 years sometimes. And the funny thing about it is that the tools that these women are using in other countries are sometimes the tools that we eschew. So there is a significant push worldwide now, both in so-called conventional cancer treatment and in so-called alternative cancer treatment, to encourage the concept of an organic and nutritious diet. I believe Mrs. Spence alluded earlier to the concept of poor diet being a risk factor for breast cancer, and it certainly is true. But beyond being a risk factor for breast cancer, it is certainly true as well that reintroduction of a very nutritious, healthy, organic diet for a woman who has breast cancer has tremendous potential to assist with the healing process, whether on its own or in conjunction with the so-called conventional efforts. So again, because our country has an abundance of the so-called cancer-fighting foods, we just need to lean out the window most of the time to find some of the most popular foods that are recommended for supporting a woman or gentleman who has breast cancer. I'd like to suggest that part of expanding the story also will be to start promoting some of these very same diets that other countries are using. And my concern is that we need to start promoting it now for our Jamaican women, to avoid the same thing happening to our indigenous foods that has happened to our indigenous herb. And I'm sure you all know what that indigenous herb is to which I refer. If we're not careful, the very things that we don't treat with the great regard that we ought to will be the very things that will be exploited from our nation. And so, in closing, I'd like to again applaud the Kiwanis Club of Providence, Montego Bay. I'd like to certainly endorse completely and provide my full support for the walk run as when it takes place. And I want to make myself available to the Kiwanis Club of Providence, Montego Bay, as well as other corporate stakeholders who are interested in expanding the story surrounding the journey of breast cancer. I believe if we unite and widen the discussion, sit together and talk about this story in a little bit more detail and with a greater openness, there is a great potential for Jamaica to become one of the world leaders in treating breast cancer successfully. Thank you.